Hey everybody, it's Dave Juno, the Meniere's Disease Warrior. How y'all doing? I'm doing pretty well, actually. I hope you are too. Um, so yesterday, there was a post in one of the groups from Neil Canham. Um, I must give him credit because I never saw this before. He did, and I'm going to talk about it. Okay, because it's something old, but something new. So this is probably going to help a lot of people who use the steroid shots, the dexamethasone. So they're testing a new way of having this medicine delivered to us. No, it's not orally. It's still injected into your ear, um, but it's a gel form. So it's supposed to be an extended release. And I guess they're finding it's really given a lot of relief to people with Meniere's disease with vertigo because the steroid is slowly releasing because it's a gel form. It's not the liquid. So the steroid, releases and then everything calms down. So it's Spiral Therapeutics is the name of the company that's doing this. Um, and they're in clinical trial stage right now. Announced a successful, they say successful, but they're the company running it, so who knows what the FDA is saying. If it's FDA, it might be something else. Um, so the phase 1B, 2A clinical trial of, it's called SPT 20-2101, 6% dextromethasone for Meniere's disease. And they only used like 21 patients across Perth, Melbourne, and Sydney. Um, Trial was two cohorts. Um, First cohort was a single administration SPT. I'm not going to keep saying that. SPT 2101, 6% dexamethasone in 10 patients. And cohort 2 was the randomization with 6 patients receiving a single administration of SPT 2101, 50 UL, whatever that liter means, ultra liter, I don't know, of dexamethasone, and 5% receiving controlled saline in, intrahepatic injection with optional crossover for non-responders, whatever that is. Um, so yeah, it's the dextrom is delivered. The steroid is delivered precisely to a round window membrane for extended release in all studies, and they found no serious adverse events with it, and no negative impact on hearing as well. All patients experienced a full resolution of myringotomy. So this sounds good. I mean, this sounds like it's going to help a lot of people. You can read the whole thing yourselves. Um, I'll put the what do you call it? I'll put the I'll put the link in the write up for it. But yeah, I mean, right here is a picture of it. It says continuous drug diffusion across the membrane and into the cochlea, 1 to 3 months. So it sounds like it's a good thing and it's going to help a lot of people. Now, I I am not a doctor. I am not a pharmacist. I have known nothing about drugs except how to take them. Um, I do know a little bit about drugs, about pharmaceutical medications. But here's the thing: I don't want to hear a bunch of questions saying when is this coming out. I don't know. They got to go into a phase 3 of it. Okay, but they did announce this, and I really thought it was a great idea to have something um, extend, have an extended release. So it's not just that one injection, right, with the steroid and some saline, and one injection, see how it goes, and it soaks in, and then that's it. This stays in your ear, right? And I think it's great. Okay? And this is what I'm talking about. There's so many different things that are coming down the line. Well, that's why I'd say don't put all your eggs in one basket when it comes to the SPI-1005 Epsilon. Okay? Because I can guarantee you right now, it's going to work for some people. It's not going to work for a lot of others. And the things I'm finding is the only people that are saying it was successful and they want to put it on a fast track was the company themselves. Okay? And that was in 2019. Okay? That was 2019. So it was 5 years ago. Okay? And it took them this long to get to phase 3 on the Epsilon SPI-1005. It's still going to take another three years before it comes out. And from what I'm reading, they're still not finding that. But this is also written up by, the company Spiral Therapeutics. And the data was presented during their 2024 AAO annual meeting. So it's coming from the company. It's not coming from anywhere else. And I guess they're out of San Francisco, California. So things are coming down the line. Things are happening. And we've got to have faith in it. And this is why I tell people, stop. Let the doctors handle it. Let this handle it. And yes, I know doctors mess up. Everybody can mess up. Okay? It doesn't matter what business you're in or what line of work you're in. A doctor, a copier technician, like I was, I messed up a lot. Everybody did everybody does in that field. At one point or another. Wastewater treatment technician. My son's a forklift driver. He could screw up. My other son's a postal worker. He could screw up. My other kid is a teacher. She could screw up. He could screw up. So it does. And I know people can say, yeah, but the doctor's dealing with your health. Well, you know what? If you're listening to somebody on the internet who isn't a doctor and is telling you to put mouth guard in your mouth because he thinks that because your jaw hurts, that you have TMJ, you're going to listen to him or you're going to listen to a doctor? Tell me. Okay? That's not right. So that's why I'm telling you, don't stop telling people what to take. Stop being doctor. If it works for you, that's fantastic. It doesn't mean it's going to work for everybody. And this might have a better shot at working for most of us than anything else at this point besides surgeries. Okay? And even the labyrinthectomy that I had, I lost my hearing in this ear. I have constant tinnitus in this ear. And now it's back to roaring, even with the hearing aids. But nothing goes into this ear. So I still have that. So not everything goes away. What went away was the vertigo. Now the vertigo's back with this, with my right ear. But yeah, this is exactly what I'm talking about. Things are coming down the line, people. And this looks more promising than Epsilon. So on that note, guys, I thought I'd let you know, Neil, thank you for bringing this to attention. He posted it in his group, and I was in that group. Actually, he lets me post about my channel in that group like once a month or once every couple of weeks. And I saw this, and I did ask him to post it in other groups. I don't know if he did. I didn't see it in the ones I run. But this was awesome, Neil. I'm glad you found this. And that's what I'm talking about. People are doing their research. He did his own research. That's awesome. So, thank you again, Neil. This sounds promising. I'm actually going to stay up to date with this. So, yeah, I'm gonna really stay up to date with this because I think this is fantastic. And like I said before, please don't ask me when it's coming out. Don't ask me when the doctor's going to do it. Don't. I don't know. And when I do know, you'll know. Okay? And on that note, I'll talk to you all later. Have a great one.